A few important things that I just did not learn in dental school. Welcome back. Happy Friday. As always, please like, subscribe, hit that notification bell. Now, these things that I didn't learn in dental school, this is based completely on my own experience. Yours might be different. You might actually learn some of this a little bit better than I did. But the first thing, the thing that I think is really important that we could be taught in dental school that we're just not, is painless anesthesia. Patients hate to get shots. It's like the most feared part of a dental procedure. And if you are a dentist that gets a reputation for being able to do painless injections, painless shots, that's huge. Honestly, the biggest compliment I get as a practicing dentist is when I give someone an injection and they tell me that they didn't even know they got a shot. If you can deliver that consistently, it's huge. And again, in dental school, they really teach you how to do it safe and effectively, get somebody numb, but they don't really go into the nuance, at least they didn't at my school, of how to make this painless. Again, like I said, this warrants its own video, and I'm going to do that eventually, and I'm still learning. So if I pick up any tips, I will share them, and if you guys have any tips, please drop them down in the comments. The first big difference between now and when I was in dental school is with my anesthetic, I go a lot slower. It might take a minute to do half of a cartridge if I'm doing an infiltration on an upper tooth. I might spend a whole minute doing a lower block. It just takes time to make it not hurt. Anesthetic generally hurts not because of the poke, but it's because of the volume of liquid that's going into that tissue and the acidity of the anesthetic that makes things hurt. So if you go slower, you're sort of numbing that spot up as you're delivering the anesthetic, and it's just more comfortable. Whenever possible, I use some sort of a tactile distraction. Basically, I am just shaking the patient's cheek. If the patient has never experienced this before, they might ask you what you're doing. It might be kind of weird, but I will tell you, in my experience, this works really well. Rather than just retract with a mirror and deposit the anesthetic, I'm actually going to use either the mirror or, even better, is my hands with a piece of gauze. I will grab their lip and I will just shake it, and shake it quite a bit. I'm not doing this the whole time. It might be, 20 seconds worth, but basically by shaking that, it's distracting those nerves in that area, and the poke just really isn't there. That initial bolus of anesthetic that kind of burns, they really don't feel that as much. And this isn't like a gentle wiggle, and that's what I used to do. I thought, why isn't this working? Because I'm sort of wiggling as I'm doing the anesthetic. What I have learned is if you're going to use that technique, you really need to shake that tissue to make it work. Another thing I do is change needles a lot. I'm not necessarily telling you to do this, but personally, I do not like to do more than 2 injections with the same needle, especially for those palatal injections, those roof of the mouth shots. If you have a brand new needle for those, it is so much more comfortable for the patient than using a needle that you've given them, 3 other injections with, because needles dull, and they dull really easily. And if you've been in clinic, you've had that experience where somebody's not numb, especially on a lower block. That is the worst. You're giving them their 3rd, 4th block with the same needle. You can actually feel how dull it is as you're doing that injection. That's something that I am just done with. I will do 2 injections with the same needle if it's a block, and sometimes with an infiltration, we'll get away with a little bit more, but if it's a block or a palatal, to me, no more than 2. Put a new needle on there. Again, I'm not telling you to do that. I'm just saying what's worked in my hands, because if you poke yourself, I don't want to be responsible for that. Another thing I do is I use a 30 gauge short for almost everything except blocks. And if someone's going to leave it in the comments, I'm well aware of the research that says patients cannot tell the difference between a 30 gauge needle and a 27 gauge. On paper, the 30 gauge is 25% narrower. Besides a block, I know of no other reason that we need to use a 27 more than a 30 gauge. And I find, at least in my hands, which is something dentists will always say, I can get better results with a 30 gauge needle. Your mileage may vary, but that has definitely been my experience time and time again. The second thing that I didn't learn in dental school, at least formally, is that managing the patient, that managing their personality and just kind of developing that rapport is as important, and in some cases more important, than the actual dental treatment I'm doing. We had like one class where we did role playing, where it would be like somebody would pretend to be an angry patient or a scared patient, and we had a little bit of dialogue. I honestly don't think we do enough of that in dental school, because I'll tell you, in my clinical practice, the biggest source of stress often is patient expectations not really lining up with my expectations. Some people need to talk to you a lot. Some people need to develop that personal connection. They had a bad experience with a dentist when they were younger, and they just want to know that you're a real person and you care about them and you're not going to hurt them. Whereas other people, they want you to shut up and get to work so they can get out of there. And it's really important to kind of recognize who's who and what their fears are, what their past experiences might kind of lead them to be like now. My first year out, I actually kind of ignored this, and I thought, I will be kind, I will be pleasant, I will be confident and do good work and kind of treat everybody exactly the same. Just go in, do my thing, I'm the dentist, and expect everybody to respond to me the same way. As time went on, I really learned how important it is to get to know the patient, at least in their circumstance, what brought them into the dentist, what might they be scared of, what kind of objections to treatment do they have? Do they have financial issues? Do they have a bad experience in the past? Because if you can kind of understand and anticipate how that patient will respond to the things that you're going to do and present, that can save you a ton of time and headache, and it can really help you be, quite honestly, a better doctor, because you can kind of be in their shoes a little bit, anticipate some of the concerns they have, and then address them head on. And this is something that's worth knowing if you don't know it already. Most complaints about dentists have to do with either like the financial policy of the office or the dentist was a jerk, something like that. Rarely, unless it's a major glaring problem, is it a technical skill issue or a problem with treatment. It's more just a lack of communication, and people just want to feel heard. A good way to alienate somebody and make sure that they don't like you is to make them feel like you're not listening to them, that you don't care what they have to say. On the other hand, if you want somebody to really think that you're a good doctor, I'm assuming you are, but really what people will judge you on is how good you are at talking to them, how good you are at connecting with them, and how good you are at sort of engaging with them and explaining what you're doing in a way that they can understand it. Now, that is a skill that comes with time, and some people are naturally more gifted at that than others, but honestly, everybody can get better at it. And what I have found, at least for me, is the more I pursue that, the more I try to be able to connect with people on their level, my days tend to be less stressful, and my patients are generally happier with their experience at our office. In my opinion, the most important thing that they do not talk about in dental school that I honestly think they should is how to manage the stress that comes with this profession. I sort of went to dental school with this naive idea that I made it into dental school. That was the hard part. Once I'm in, I just get through those 4 years and everything's going to be great. Because looking at the dentists I knew, they had, decent cars and nice houses and good family, and everything looked okay. And so I figured, make it through school. That's the hard part. The career is it's just going to be gravy. And it's just not true. It is a very stressful career. It can take you out emotionally, physically. I really underestimated how stressful the day-to-day work would be. And it continues to this day. There are days when I just leave work feeling completely beat down. Honestly, I feel like that's something that nobody talks about. We're all just supposed to pretend that this job is super chill and amazing. The truth is, dentistry is hard. It's hard physically, it's hard mentally, it's hard emotionally. And then when the burnout comes, which it probably will at some point for most people, you feel alone because you feel like I'm the only one that's this stressed out. Everything I see in dentistry and the media and magazines and even talking to your friends, everybody looks like they're just having this amazing time of it. And you're stuck here wondering if you chose the wrong career. I've talked to plenty of people in this boat, and to be honest, I've been there myself. The truth is, as rewarding as this job can be, it can also be incredibly stressful. I wish I had some specific advice on how to, snap your fingers and make the stress go away. It doesn't work like that. The one piece of advice I would give is that if you get to that point where you're that beat down, that stressed out, either in school or in this profession, in whatever, reach out to a friend or a colleague, family. I honestly think you would be surprised how many people have dealt with those same stresses, myself included. Now, of course, eating well, exercising 4 days a week, getting enough sleep, all of that stuff can help. But it's also important to recognize that you're in a job that's stressful, and sometimes there's really nothing unusual about feeling that stress. A lot of times you can recognize that and then make some positive changes, whether it's looking at applying for a job at a different office, it's looking at maybe cutting back a day a week until you feel a little bit better, more energized. Whatever it is, a lot of times there's a positive change that you can make to make your career a little bit better and a little more consistent with what you've, sort of dreamed it was going to be. Now, I would consider that like that little bit of surface level stress. Those are great things to deal with that. If you get to the point where it's just deeper than that, like it's a major issue, you really legit feel like you're in the wrong career, I would again encourage you to reach out to a friend or a colleague, family, somebody that knows you and your situation that you can just kind of vent to. But also know that you are not alone. You are probably one of like 20,000 dentists out there that feel exactly the same way. Everybody goes through burnout. Everybody goes through seasons of stress. And again, you're in a profession that can be really stressful. This is honestly a topic that's pretty serious that I think warrants its own video, but I did want to bring it up because again, in dental school, they don't really talk about that. And you could argue that it's not the fault of the school, that the school's there just to teach you the dental skills and then stress management's more of a life skill. But at the same time, I think it's ubiquitous enough in dentistry that we see it so often that it's something that's worth addressing, and it's worth addressing early. Now, because stress in dentistry is such an issue, I want to end the video with this. This is not my original idea. It's from a pediatric dentist, Jared Johnson. I'm going to steal this idea from him. It is a challenge to reach out to at least, let's say 3. We'll make it easy. Reach out to 3 people that you know, whether it's a fellow student or a dentist, or if you can't think of them, just anybody. Reach out, see how they're doing, let them know that you're there for them if you need anything. I thought it was awesome when I first saw Jared's challenge, and I reached out to some people, and I think it's just great to kind of maintain those connections because then you feel like you're not alone, and at the same time, it's something to connect on that's not really superficial because people need that depth in their relationship. They need people that they can rely on. And if you can be that kind of person for somebody else, that strengthens you. That helps you be able to kind of handle your own stuff a little bit better, believe it or not. Again, I'm not making any promises. I'm not a psychologist. I'm just telling you what's worked for me. So take Jared up on his challenge, reach out to 3 friends or colleagues, and just check in and see how they're doing. As always, please like, subscribe, share the video with anyone that might find it helpful. Reach out to 3 colleagues, and I will see you guys soon.